Welcome to CHI and welcome to CHI Innovate 2022. We are so happy to welcome you to the finale of our conference series for this year. I'm Hon Tim, the Clinical Director for the Center of Healthcare Innovation, or CHI as we call it here. And do you know that the last time we had a gathering this big was 2019, pre-COVID. So it's wonderful to have everyone back, wonderful to see all these warm bodies instead of people on a screen asking them to unmute or mute. So we're not going to have any muting or unmuting for this conference. Welcome, welcome. We're very lucky because with us today as my co-host for the opening ceremony is a very familiar face to CHI and to this conference. Please welcome Ms. Tamsin Grulich-Smith, the Director of School of X from Design Singapore Council. Welcome, Tamsin.
Thank you. Oh, good morning, everybody. I was just saying to Tim, how many people are there in the room? Around 500 of you. That's amazing, and I think it's probably more people than I've seen for 3 years.
That's right.
Thank you so much for coming today. It's wonderful. It really is amazing and maybe overwhelming, but very nice to say, you're on mute, or not, yeah? No, okay, we've got an amazing day ahead of you. I'm honestly, genuinely excited about it. Some of the speakers we have are really impressive, but there's more than just events on stage today. I think on the screen in a minute, you're going to see something about the other events and activities that we have in store for you today. Brilliant, like magic, thank you. I think starting down at level 2, we have, oh, you can see it here on the screen, the CHI Startup Enterprise Link Showcase. So it's effectively known as Chisel. And that's where you can see some of the highlights of the innovations that are really looking to be test-bedded in healthcare settings and rolled out for scale. So earlier in the year, we had InnoMatch 2022 here in this very auditorium. So you'll be able to meet the winners of that event and see how they're starting to take forward their ideas.
Right. And still on level 2, there's also a healthcare innovation exhibition, so that's our trade show. We've actually got 26 exhibitors all together. Some of them will be there, showcasing all types of innovative solutions. So we've got running the range from AI, machine learning, food tech, clinical informatics, video analytics. So please, during the breaks, get down there and see what solutions that might be applied to your patients.
And you can also keep a lookout for our special sponsors down there as well. We'd like to give a big shout out and special thanks to our special exhibitor, ST Healthcare. They specialize in improving healthcare supply chain processes. To our special sponsor, Salesforce. Of course, I'm sure you've all heard of Salesforce. Yeah, the #1 CRM platform in the world. And our silver sponsor, NEC Asia Pacific Private Limited. That's an applied research AI lab. So go take a look at all the fun stuff down on level 2.
Okay, great, thanks. So we're moving up CHI. So from level 2, we're going up to level 4, which is where we are now. So outside the auditorium, there's a cafe, just a little bit of a distance down there. And near that cafe is Chirp, or the CHI Reimagination Plaza. And inside Chirp, please have a visit, is where some of our colleagues from Tan Tock Seng Hospital are showcasing their project Hospital Without Walls. So that's a systems-wide change that Tan Tock Seng is undergoing now, and you'll see digitalization affecting how care can be delivered to patients wherever they are at any time. So the projects that are in Hospital Without Walls include Ward Without Walls, Pharmacy Without Walls, and every moment's a rehab moment. So please check that out as well. That's Chirp.
So much to be inspired and excited about today, but also moments of celebration. Not far from here, you'll find the National Healthcare Innovation and Productivity Medals winning posters on display.
Just outside.
Yes,
yeah.
We're actually going to reveal the winners later on this morning, so stay tuned. I don't need to say it because you're here. You can stay tuned, yes. I just remind you how lucky we are to be here, everyone.
Still on Zoom speak, yes. All right, and last but not least, right at the top of CHI on level 9, we're going to have a very special cocktail and networking session at the end of the conference, at the end of the evening, if you're with us. So if there's nothing like alcohol to entice people to stay back, then I'm not sure what else people will stay back for. But that's very kindly brought to us by one of our key sponsors, Salesforce. You'll also hear from their Chief Health Officer, Dr. Brian Tan, who also happens to be one of our panelists as well, and he's in the audience there. We've just said hello to him. So please pre-register for this cocktail session. I believe alcohol is limited by scanning the QR code on the screen, or you could simply rush up to level 9 at the end of the conference at about 5:15.
Rush up, yeah, I think so. There's something to look forward to all day long, and I will see you there. What an amazing day we have ahead of us.
Indeed. All right, and who do we have with us in the audience today? So we are very, very honored to have our very special guests, Dr. Janil Puducherry, who's the Senior Minister of State for Ministry of Communications and Information and MOH, very well known to us. Thank you, Dr. Janil, for joining us. Next to him in front is Prof. Philip Chew, Group CEO of National Healthcare Group. Thank you, Prof. Chew, for coming. And flanking Dr. Janil on the other side, Prof. Eugene Fidelis-So, CEO of TTSH and Central Health, and also Chairman of the CHI Co-Learning Network. Welcome, Eugene. Behind them, I'm just mapping out everybody. We've also got the NHG board members and also many senior management members from our other fellow clusters, Sing Health as well as NUHS. So welcome to CHI to all of you. And just sitting a bit over there are all our CHI co-learning partners. Welcome, everybody.
Welcome, everybody. Absolutely. So, we have had the honour of having DPM Heng Swee Kiat as a guest of honour for CHI Innovate 2022. So, although DPM Heng can't be here today, he has captured a pre-recorded message for us, which we'd like to play to you all now. So, perhaps we can roll the clip, please.
Right. Ladies and gentlemen, I'm very happy to join you virtually this morning for CHI Innovate 2022. Singapore's healthcare system has come a long way. Over the years, we've built a world-class healthcare system that we can be proud of. We have achieved one of the best health outcomes in the world while ensuring healthcare is affordable and accessible. But it is a continuous challenge to achieve a good balance between what some have called the iron triangle of healthcare: cost, accessibility, and quality. There are inherent trade-offs that make it difficult to achieve all three outcomes simultaneously. With our rapidly aging population, we're also facing tighter constraints, a more limited labor force, and tightening fiscal space. When I was finance minister, healthcare was one of the things that kept me up at night. Finding an optimal spot within the iron triangle will remain a challenge for Singapore and many other societies. The key to overcoming the iron triangle is innovation. Human health and potential is therefore a key thrust in our national research plans. But it is not just about research and innovation. Just as important is the translation of innovation into impact. So I'm glad you have chosen the road from innovation to impact as a theme for today's event. Let me share 3 ways in which I think we can achieve greater impact in healthcare innovation. First, innovation at the systems level. Second, innovation in the use of technology. Third, fostering an innovative workplace culture. First, we must innovate at the systems level. In this regard, a key innovation is to shift decisively from healthcare to health. In most countries, there's too much focus on healthcare and not as much on health. There is an over-reliance on medical interventions, with much of the care centered around hospitals. This leads to sharply rising healthcare costs and overburdened hospitals. In Singapore, we are implementing Healthier SG, a major national shift towards a population health approach. At the systems level, we'll further shift our emphasis from reactively caring for those who are sick to more proactively promoting good health. And in doing so, we hope to shift the focus from hospitals to the community. One concrete manifestation of what it means to shift the focus of our system to the community is a health district at Queenstown initiative. This is a collaboration between HDB, NUHS, and NUS, along with many other agencies and partners. We will pilot innovations and initiatives in the neighborhood that will help the community to lead healthy lives regardless of age. For senior residents, we hope that they can enjoy more years in good health, allowing them to remain active. This brings me to my next point. Beyond systems-level innovation, innovations in the use of technology will reshape the healthcare sector. Even with the best of health promotion and active aging, people will still fall sick at some point, perhaps later in life and hopefully for a shorter duration. But as our population ages, the demands on healthcare will increase significantly, even if we reduce the care needed for each individual. So we'll need to use technology and innovate how care is delivered. COVID-19 has accelerated digitalization across many industries. In healthcare, there is now greater use of telemedicine. Internet of Things will also pick up pace going forward. Already, wearables are commonplace today. When coupled with AI, they are powerful tools for managing chronic diseases. Our healthcare clusters and hospitals are riding on these trends. For example, Tan Tock Seng Hospital has developed a vision of hospital without walls with the support of CHI. By using intelligent systems and sensors, the hospital can more effectively monitor and manage its patients within the community on a real-time basis. I'm glad to announce that Tan Tock Seng Hospital is ramping up the use of telehealth and will be launching teleports in 2023. These teleports will provide clinicians with a conducive environment to conduct their teleconsultations. Some of the pods will even cater to remote exercise demonstrations by allied health professionals, so that patients can join in these exercise sessions from the comfort of their homes. While telehealth is a relatively mature technology, we should also explore other emerging technologies and tools. One example is virtual reality and augmented reality, or VR/AR. VR/AR can be a powerful tool for healthcare education. They can provide an immersive learning experience for medical students and healthcare professionals, especially in the handling of acute care situations. I'm happy to announce the launch of the new virtual CHI Living Lab early next year. This is a collaboration between CHI, SingHealth, NHG, NTU Lee Kong Chian School of Medicine, and Duke NUS. The new lab will enable innovation, validation, implementation of VR/AR applications in healthcare education. Beyond digital innovations, there are many other innovations in the use of technology that will reshape the healthcare landscape. CHI and Temasek Foundation has organized the Healthcare InnoMatch, an open innovation challenge. 6 companies have received funding for their innovations in areas such as AI, predictive analytics, and others. Importantly, the 3 public healthcare clusters joined this effort for the first time this year. Each cluster paired up with the winners, helping to testbed their innovations in actual healthcare settings. This will accelerate the development of technologies. I'm glad to see these public-private partnerships and hope that many more will come together to define our future challenges and co-create solutions to address them. This brings me to my last point. Ultimately, we need an innovative workplace culture so that innovations can percolate throughout the healthcare system. Healthcare ultimately remains a high-touch industry. It is the doctors, nurses, pharmacists, allied health professionals, and other healthcare professionals who make the healthcare system tick. As our population ages, we'll need even more healthcare professionals. MOH has projected that we'll need 24,000 more nurses and healthcare staff by 2030. But even though healthcare will remain high touch, it doesn't mean that there's no room for innovation. In fact, it is the opposite. Innovation will be critical to support our healthcare professionals so that they can continue to do their best for their patients and keep costs affordable. The key is that we must encourage an innovative workplace culture within healthcare settings so that every healthcare worker feels empowered to make suggestions on how to innovate for the better. To foster this culture of innovation, everyone has a role to play, from the healthcare leaders to healthcare staff on the front lines. In this regard, I want to take the opportunity to congratulate the winners of the National Healthcare and Productivity Medals. These medals are an important way to celebrate healthcare professionals who have pushed the boundaries with breakthrough ideas. There are 8 National Healthcare Innovation and Productivity Awards this year. The winners are recognized for their innovations in care redesign, automation, IT and robotics, workforce transformation, and adoption. In all of these projects, the spirit of innovation and collaboration shines through. I've spoken about 3 areas of innovation: at the systems level, in the use of technology, and in the workplace culture. But underpinning all of this is partnerships and collaboration. There is much that our healthcare clusters can learn from each other and collaborate with industry, research institutes, as well as international partners. The project that won the Best Adoption Medal this year, which looked at using wearable robotic exoskeleton for rehabilitation care, is a good example. It was a collaboration across many institutions: NUHS, St. Luke's, Stroke Support Station, and NTUC Health. I encourage all of you to continue to break down boundaries, learn from each other, and forge stronger collaborations. In that regard, I'm glad that CHI has been facilitating such collaborations since 2016. You formed a co-learning network comprising healthcare institutions, research institutions, and other stakeholders. Today, you have 37 local and international partners. CHI Innovate is yet another example of how we can bring together thought leaders from all around the world to learn from each other and co-create solutions. You have an exciting program ahead of you today, with various speakers sharing on how to maximize the impacts of healthcare innovation. I wish everyone a fruitful conference ahead. Thank you.
Thank you, DPM Heng, for that opening address, and I'm sure that everyone here in the audience is committed to, as he said, dissolving the boundaries between the clusters, between health and healthcare, and between private and public as we work towards healthier SG. Now, DPM Heng also mentioned the NHIP Awards, and it's time to present these awards now. So we're talking about the National Healthcare Innovation and Productivity Medals. This is an annual award. In short, we call it the National HIP Medals, and it's in its 6th year running now. It's supported by the Ministry of Health. It's funded and sponsored by the Ng Teng Fong Healthcare Innovation Program and managed here at CHI. This prestigious national award provides the opportunity for all of us to acknowledge and to celebrate the best innovations in the past year.
So the medals recognise teams who achieved excellence in 4 award categories that we just heard about from DPM Heng. We have care redesign, automation IT and robotics innovation, workforce transformation, and a new category which looks at adoption. And this was just added this year to really look at the team that's upscaled and accelerated the adoption of innovations beyond hospitals into the community for sustainable and meaningful patient care.
Now, this year we received a record-breaking 98 submissions from all of you. I think a lot of pent-up energy after COVID. And they were assessed by a very distinguished panel of judges, some of whom are in the audience today. I see Weng Sun here. But the panel of judges was headed by Dr. Benjamin Koh, who's DS Development for Ministry of Health. So we'd like to say thank you for the judges for all their hard work.
Thank you. So, it's the exciting moment. I love it when we get to do this, okay? After months of shortlisting and reviews by a panel of judges, we have for you today the results of this year's National Healthcare Innovation and Productivity Medals. Let's find out who the 8 winning teams are, and let's have a look at their projects.
The Community Response Team was set up by St. Luke's Hospital as a community and home-based rapid intervention team to assess, diagnose, and manage dementia in order to prevent escalation and the needs for hospitalizations for persons living with dementia. Our team is set up to be able to do home visits on short notice and at no out-of-pocket cost to the patients to stabilize very stressful situations in caregiving and to prevent the need for tertiary hospital stays. This person-centered approach is responsive to the healthcare needs of persons living with dementia and has brought about cost savings to the healthcare system through reduction of preventable hospital admissions related to dementia and mental health.
DEFINITE is the acronym for diabetic foot in primary and tertiary care and aims to achieve a coordinated multidisciplinary care across primary and tertiary institutions. In primary care, at NHG polyclinics, we have the DM Foot Step for ulcer prevention. And in tertiary care, they have the multidisciplinary team-style deep clinics.
At 18 months, we were able to demonstrate a significant reduction in major lower extremity amputation with a decrease of about 20% and also a significant reduction in minor lower extremity amputation of about 60% reduction. We were able to upskill nurses and also create a diabetic foot coordinator role to ensure that patients do not fall through the crack.
There's an interesting paradox in healthcare. We use a lot of energy to provide quality care to our patients, but the environmental footprint can be harmful to people's health and likewise the ecosystem. To maintain a sustainable and resilient facilities through the use of predictive maintenance, installations of energy efficient devices. We also leverage on technology to optimize energy efficiency. For example, in our OT setback projects, all OTs that are not in use are put into a sleep mode, and that helps us to achieve quite substantial saving in terms of energy. Last but not least is environmental stewardship, where fellow colleagues embraces sustainability and places sustainability as the core of what we are doing. NUHS Group FM has moved from the preventive maintenance to predictive maintenance mode with an emphasis on improving the overall resiliency and effectiveness of the building. One is to use the drones to conduct building inspection because it is cheaper, it's very, very effective, and the images captured allow us to have very precise information on the building defects, and that's where my engineers will come in and do the rectification. Now, using our IoT sensors allow us to predict the maintenance of the buildings as well as the equipment. Now, we introduced this touchless technology in distal leave during COVID-19 days with the intentions of improving infections control and be less dependent on the housekeeper to clean the leave.
The Clinical Diabetes Educator Program was conceptualized in 2019 together with our allied health partners. Our goal was to optimize care delivery for our clinic diabetes patients who have numerous care needs.
This novel transdisciplinary diabetes project was conceptualized to streamline diabetes care by cross-training and elevating the capabilities to a new role known as the Clinical Diabetes Educator or CDE. Through the program, the CDEs are empowered to perform transdisciplinary roles to address multiple aspects of diabetes management in a single visit.
More importantly, it is also a greater satisfaction for CDEs to provide holistic care to all our patients.
Well, first thing first, there aren't actually any physical or mechanical robots in RPA. Robotic process automation is the use of software bots that mimics most human-computer interactions to carry out a ton of error-free, voluminous, repetitive tasks. RPA bots complement our workforce as digital workers to improve efficiency so that our staff can focus on higher value work to bring about better care delivery, patient outcomes, and experience.
Since we have implemented robotic process automation in our operations, it has helped us to automate an average of 588 orders per day to save manpower resources and improve accuracy.
Improving mobility via exoskeletons, or iMove for short, arose out of our desire to bring enabling rehabilitation technologies closer to the people who needed them. Over a period of 3 years, we recruited 441 patients from Alexandra, Jurong Community and St. Luke's hospitals and day rehabilitation centres run by Stroke Support Station, NTUC Health and St. Luke's Elder Care. We found greater improvement in mobility function for the more severely dependent walkers with the exoskeleton training compared to controls.
Clients can take many more steps, which enhances neuroplasticity and cardiovascular training. Using EXO decreases the number of therapy staff to work with the client, as you only need one therapy staff to operate the device with another person standing by, when previously we may need 2 or 3 therapy staff to walk a client.
Most of our centres have successfully implemented the program and will be incorporating the use of exoskeletons into usual clinical care.
As part of communal living and active empowerment, Renzi encourages our nursing home residents to move freely within designated areas. However, some residents, especially those with dementia, may abscond or wander out. To keep residents safe, the team adopted Smart Geofencing System, SGS, which uses RFID technology to track and record movements, and alert staff if residents walk past a RFID reader at non-designated areas. This initiative enables our residents to have more social interaction, as they are able to visit friends at other levels, which is important for cognitive health and the overall well-being for all our residents.
Wow. Congratulations to all our winners. Many, many great ideas. Let's shamelessly copy from each other, please. May I now invite our special guest for today, Senior Minister of State, the Ministry of Communications and Information and MOH, Dr. Janil Puthucheary, to present the awards to our winning teams. Dr. Janil.
Thank you. We'll now be presenting the medals to the winning teams in no order of merit. They're all wonderful winners. For the category of Care Redesign, the Best Practice Award goes to Community Management of Dementia by a Community Response Team from St. Luke's Hospital. Thank you. Next, the Best Practice Medal for Care Redesign also goes to the Diabetic Foot in Primary and Tertiary Care Project from National Healthcare Group.
Next, for the category of Automation, IT and Robotics Innovation, we have placing sustainability at the core of everything we do, from Ting Fong General Hospital and Jerome Community Hospital. The other award in this category, the Best Practice Medal for Automation, IT and Robotics Innovation, also goes to NUHS for Facility Management Strategic Transformation from Preventive to Predictive Maintenance.
Coming up next for the third award category on workforce transformation, the award goes to the Clinical Diabetics Educator Programme, a novel transdisciplinary model for diabetes care from Tan Tock Seng Hospital. Thank you. We also have a Best Practice Medal for Workforce Transformation, which goes to Enhancing Workforce Productivity Through Digital Workers, SGH's RPA Journey from Singapore General Hospital.
Next, our brand new award, the Best Adoption Medal, and it goes to Improving Mobility via Exoskeletons, in short, iMove. A massive team from Alexandra Hospital, Stroke Support Station, St. Luke's Hospital, St. Luke's Elder Care, NTUC Health, Jerome Community Hospital, and NUH.
A true collaboration there. Last but by no means least, ladies and gentlemen, the Excellence Champion for the National Healthcare Innovation and Productivity Medal is awarded to the team who's demonstrated exceptional innovation and productivity in more than one category. This goes to Smart Geofencing System for Resident Safety from Rense Hospital. Congratulations. Congratulations. May I invite all the winners back onto the stage, please, for a lovely photo.
Congratulations again to all the winning teams. Now, audience, if you would like to know more about their projects, you saw a clip in the video just now. Please visit the showcase that we have just outside this auditorium. Thank you. Congratulations again to everyone.
Thank you. It now gives me great pleasure to invite the special guest of CHI Innovate 2022, Dr. Janil Puttucherry, Senior Minister of State, Ministry of Communications and Information, and Ministry of Health, to deliver his keynote address to the conference with a topic towards a smarter and healthier SG. Dr. Janil, thank you.
Professor Philip Chu, Group Chief Executive Officer of National Healthcare Group. Professor Eugene Fidelis-So, Chief Executive Officer, Tan Tock Seng Hospital, and Central Health Chairman of CHI Co-Learning Network. Ladies and gentlemen, good morning. I'm pleased to join you here at the flagship day for CHI's Innovate 2022. Earlier this morning, I had the privilege of officially opening Tan Tock Seng Hospital's Medical 3D Printing Center in its new home at CHI. Previously located at Tan Tock Seng, the new center houses 7 machines and counting to meet increasing demand and popularity of 3D printing services and the use of this technology and its application in healthcare. Since its inception in 2022, the center has printed over 200 3D models for clinical, education, and research purposes. These patient-specific, customized anatomical models facilitate the patient's understanding of their medical conditions. They enable surgeons to practice and plan beforehand, and they save precious intraoperative time. In addition, these 3D printed surgical adjuncts provide a cost-effective solution in helping surgeons achieve more precise and efficient clinical outcomes. When we think about creating impact through innovation, often we tend to think of new technology. And no surprise, rightly so. You look at how much technological progress we've witnessed since the turn of the millennium, how much we've achieved, and even recently over the last couple of years, what we've done through the pandemic. By innovating with purpose, we've made significant strides in taking that technology and applying it within the healthcare domain to become more cost-effective, to discover smarter ways to provide better care for our patients, and to empower them to lead and live healthier lives. This will be increasingly important for all of us as our population ages rapidly. Singaporeans aged 65 and above are expected to increase from 1 in 6 of our population today to about 1 in 4 by 2030. And as this happens, if people fall sick more often as they age, if we have a rising prevalence of chronic diseases, hypertension, hyperlipidemia, there will be considerable health, emotional, financial burdens placed on all of us in the coming years. And this is the impetus for one of the most significant transformations within our healthcare space in recent years, Healthier SG. Our intent is to take action now to prevent or delay the onset of ill health, slow and hopefully even reverse these trends. As we move our emphasis from caring for those who are sick to proactively empowering and preventing individuals from falling ill, proactively empowering individuals to play a role in preventing themselves from falling ill, it's imperative that we continue to innovate to help to create this smarter and healthier Singapore. Under this Healthier SG strategy, there are 5 key features. The first is to mobilize our family physicians, our family healthcare networks, to deliver preventive care for residents. Currently, only about 3 in 5 Singaporeans have a regular family doctor. We hope to grow this number by bringing more doctors on board Healthier SG, working with them to enhance their capabilities to practice within the primary care setting effectively as a family doctor, and most importantly, encouraging residents to sign up with them, to develop a trusted relationship with them with a focus to improving their health before they become sick. Secondly, as an extension of this strategy, we want to develop health plans, including lifestyle adjustments, regular health screenings, appropriate vaccinations, adjusting diet, exercise, together in partnership with the resident, together in partnership with their family doctor, discussing the importance of these various factors based on their existing health and the trajectory of their health going forward. This will require regular check-ins for the doctor to meet their enrolled residents on their health plan, find out the latest developments in their health, their adherence and their compliance to the health plans, and their progress in achieving health goals. In doing this, we come to our third strategy, which is to involve and activate community partners to support residents in leading a healthier lifestyle. A health plan is not about your visit to the clinic. It's about what you do between the clinic visits, about your daily life and your lifestyle. So you need to carry out your plan not by ticking the boxes and having the conversation with your family physician, but in between those visits. We hope that Healthier SG will empower residents to chart their own journey towards healthy and active lives, supported by community partners such as the Health Promotion Board, our Agency for Integrated Care, the People's Association, Sport Singapore, our National Parks Board. Taking advantage of many programs, activities, community events, brisk walking, qigong, community gardening, ball games, workouts, all of these things are happening in the community and we need to use them to lead healthier lives. Fourth strategy is commitment. We need a national enrollment exercise. We need our residents to commit to seeing one family doctor, having that continuity of care as they act on a health plan. The residents will be able to choose their doctor, choose which family doctor, which practice to enroll with, to suit their needs, to their location as they change where they work or where they live. But we want that commitment. And while the family doctors will serve as the first point of contact to holistically manage the residents' health, this national enrollment program will be coordinated by our 3 healthcare clusters, the National Healthcare Group, National University Health System, and SingHealth. And each will look after approximately 1.5 million residents. The clusters will work with family doctors and these other partners in the region to reach out to as many residents as possible and drive and manage population health within their region. To build the participation base progressively, enrollment will open to residents aged 60 years and above in the second half of 2023, followed by those in the 40 to 59 age group in the subsequent 2 years. Finally, to make all this happen, our 5th strategy are the necessary enablers, IT systems, manpower development, financing policies that will be needed to make Healthier SG work. Our healthcare manpower needs to be suitably sized, differently organized, and equipped with the right skills. IT systems should ensure a seamless sharing of data to facilitate this concept of integrated care. And our financing policies will need to incentivize all the healthcare providers to place a greater emphasis on preventive care, while ensuring that the necessary and needed treatment continues to be delivered for the benefit of the resident. Our healthcare clusters will function as regional health managers, working with MOH, Ministry of Health, and other stakeholders, and partners to positively improve the social determinants of health. That could include a variety of factors: early childhood development, employment, the built environment, social networks that shape our outlook on life, as we know that health outcomes are influenced by the way that people grow up, live, work, play as they age. In this 5th strategy, apart from the IT and data sharing element, technology will play an important role in this Healthier SG journey to support preventive health efforts, bringing healthcare from the hospitals to the home. I'm sure, I hope many of you are familiar with Health Hub. We used it, I hope you used it during the pandemic, checking your vaccination entries, your test results, what was your COVID-19 status. But this product, Health Hub, is also a national population enablement platform for digital health. You can conveniently access it using SingPass for Singapore residents. And you can not just view the healthcare records of yourself and your immediate family, but also obtain health and wellness information and perform transactions across our public healthcare institutions, making appointments, paying bills, refilling medication. Some of you might have also been using Healthy 365, keeping up with HPB's STEP challenges. Beyond these types of transactions, this type of convenience, we want to enhance Health Hub and Healthy 365 as a product, a platform that can nudge residents to take meaningful, healthier actions in line with their health plan, keeping them engaged through recommendations and registration for lifestyle programs, and tracking their achievement of their health outcomes, which are part of their health plan. We're only just starting to skim the surface of what we can do to create exciting and effective new models of convenient clinical care for our residents. One example is Tan Tock Seng's Hospitals Without Walls concept, where care is redesigned with digitalization as a key enabler. Instead of being confined to the walls of the hospital, the care follows the patient. Increasingly, that patient is empowered through digital tools to manage their own health anytime, anywhere. I have 3 examples of projects under this ambit, under this concept of Hospitals Without Walls, to better illustrate this. The first is the Clinic Without Walls, leveraging the use of the Health Hub app to redefine patient experiences. This counterless clinic empowers patients to register on the go, keeps them up to date on the queue, as well as the number of patients ahead of them, giving them better control of their schedule. It reduces needless waiting time at registration counters and registration kiosks, and eases the load of our staff in healthcare institutions, as there's less reliance on them to support the registration process and answer inquiries on queue status. Secondly, the use of AI-powered fall prediction and temperature monitoring sensors. Remote care beyond the wards is now possible under the Ward Without Walls project. These sensors provide a non-contact, non-intrusive, and continuous patient monitoring service, which yields productivity gains and, I hope, better clinical outcomes and better patient safety. And because of the way it's implemented, a better patient experience. Providing early detection of falls, these initial trials were successful, and it's been expanded from a one-to-one setting in single rooms to a one-to-many setting to test the detection of falls amongst one of multiple patients within a given setting. And I understand there are plans to trial the technology for community and home-based care. Third example, pharmacy without walls. This was started with the aim of empowering patients to provide a better patient experience around the pharmacy process. Just the simple inclusion of a QR code on medication label, this user-centered technology-enabled design thinking empowers patients to better manage their own health. It increases patient activation and population health literacy by using that QR code to simplify and improve the accessibility of information to the patient about their medication, and ultimately, hopefully, improving adherence and compliance to the clinical plan. Every year, our public healthcare institutions, our partners, our stakeholders, our healthcare professionals continue to imagine smarter, better ways of doing things so that we can serve our patients, our residents, our clients better. One example, they just won the award, Enhancing Workforce Productivity Through Digital Workers, our SGH's Robotic Process Automation, RPA journey by Singapore General Hospital. They won the Best Practice Medal for Workforce Transformation under the National Healthcare Innovation and Productivity Medals Award. RPA, an emerging technology, automates manual tasks and business processes through digitalization. It uses software tools, robots, machine learning, and AI to emulate the human process of performing a task and churning out the output at a much faster speed with little to no chance of human error. The use of this can help to cut costs, save time, create sustainable processes, and maximize the use of our valuable resources, our most valuable resources, the time of our healthcare workers. SGH started using this technology in late 2020, and by July 2022 has reaped about $650,000 worth of productivity gains through the use of robotic process automation alone. I'd like to congratulate all the winning project teams, applaud them on making a difference, changing the concepts of healthcare service delivery. It's going to take a fairly bold reimagination of our healthcare landscape. Our ambitions need to be large to make these big changes in our entire ecosystem in order to achieve the goals that we have set for ourselves. This will mean disrupting familiar processes and trying unfamiliar solutions, often based on technology, but involving business process reimagination and reengineering, for us to make real progress on this transformation journey and deliver real outcomes for our patients, our clients, our residents. There are many exciting possibilities in the future of healthcare innovation and the use of technology within the healthcare space. So please join us in having big dreams and journeying with us on this effort towards a healthier Singapore. Thank you very much.
Thank you. Thanks, Dr. Janil. Thank you very much. And we'd now like to invite Dr. Eugene So and Prof. Philip Chu to accompany Dr. Janil as he takes his leave. Thank you very much. Thank you for joining us, Dr. Janil. Now, we also have a tour planned for some of our VIPs, so if you know who you are, please follow our ushers as we leave to proceed with the tour as well.
Thank you. So for everyone else, wow, what a start to the day, huh? We have a 40-minute break, how generous, which means all the people you've seen around the room, you normally have 5 minutes and you have to queue at the washroom. 40 minutes, and I know you'll have been standing and saying, oh, I haven't seen them for 3 years. So plenty of time to chat. Please be back here by 10:20. You can go down to level 2 to grab some food, and also what can you see down on level 2? All those great exhibits. So please enjoy the next 40 minutes and we'll see you back here soon. Thank you.
See you later. All right.